Dr. Tim Alford of Kosciuszko, emergency room doctor at Baptist Atala, is the second hospital-affiliated doctor to treat positive for COVID-19. And we have the story because the man is with us and deep within the confines of his quarantine basement, I do believe. Dr. Alford, good morning, sir. How are you feeling?
Good morning, Paul. I'm feeling better, thank you.
Good. Now, tell me a little bit about this and how did this happen? First of all, when did you first suspect that you had it?
Well, like you said at your introduction, I am an emergency room physician. I did family medicine for 30 years, and then I'm finishing up my career doing emergency room medicine in our community. I had done a shift on Monday, and then Tuesday I began to feel a little bit of a slight cough. I thought it was just spring allergies like I usually have. And then on Thursday I was actually going downtown in Kosciuszko to deliver some packages, and that flu-like feeling came down on me like a ton of bricks. And I quickly reversed my tracks and went by our local clinic who actually have a very efficient outdoor testing system set up. And I was tested Thursday morning. My results came back at 10:30 p.m. on Saturday night. During that period of self-quarantine, I was feeling pretty rough. That was probably the rockiest time during that time when I was waiting on my results. I'd probably consider the fact that I've got a mild case. Mild cases are pretty rocky. I feel so sorry for these people that have more severe cases. This is no picnic. It is the real deal.
Did you get a flu shot?
Oh, yes.
So the flu shot has no bearing, because we don't have the data in on that yet. I understand they're looking at that too, trying to get enough data on it. But it appears that the flu shot has no bearing. It's not going to lessen this one way or the other.
No, although it's my understanding that you can have both. You can have both the flu and you can have this. In fact, there is some thinking now that maybe the flu can make you a setup for this. It's a possibility it could make you more vulnerable to this. But I was simultaneously checked for the flu and for COVID, and my results came back COVID only.
Have you had the flu before during your long lifespan? And you as a doctor, you know what the flu feels like.
Oh yeah. In fact, I had the flu when I was in medical school that probably felt about as bad as this. Yeah. I've had the flu on 2 other occasions, even though I take the flu shot. Of course, the vaccine technology is getting better and better, and they're able to be more on target with the formulas for flu vaccine. So I have really avoided the flu the past really 10 years.
Can you distinguish differentiate, because of your personal experience and also your medical background, the respiratory differences between the flu and this one? Well,
I never really had a lot of respiratory stuff with influenza. Of course, influenza A now is more of a respiratory virus, and influenza B tends to involve the gastrointestinal tract more. But in this case, I have really never felt chest tightness, respiratory difficulty like I felt during a 2 or 3 day period this time. I actually was monitoring my oxygen saturations at home, and at one time they got down to 90%. Well, my oxygen saturation, I stay pretty healthy. I've never had oxygen saturation that low, and the devil of that is that it didn't feel like it was that low. I felt bad, but I was not that short of breath, or I didn't feel that short of breath.
Mm-hmm.
That happened to be late in the afternoon when the flu feeling was really raging. And then the next morning, when I woke up, my oxygen saturations were back up to 97%. So I'm thinking I dodged a bullet along the way, and very fortunate to. I think I'm turning the corner and doing better now.
Did you take the chloroquine? Were you able to do that?
Yes, I started the hydroxychloroquine. One of my former partners, Dr. James Withers, who really stays on top of this stuff in town, suggested that I go ahead and start hydroxychloroquine. We try not to treat ourselves, and so I was really trying to follow advice of my colleagues, and he suggested that I go ahead and start it. That stuff is not. It's got its own side effects, some of which are very similar to the COVID virus. So I was very reluctant to start it, but I did, and I feel like that it's helped. But there's no way to really know that because the studies, we just don't know enough about it at this point to know whether that medicine really does help. I also started azithromycin, which everybody knows is a Z-Pack.
Yeah. I got to ask you, as far as the hospital itself, that you will sooner or later go back to, but what's the status there as far as the number of beds? And apparently there are people being seen there that we didn't know because of testing or lack of testing whether they had it or not.
Right, and really back in, I guess it was really maybe for the first week in March, we had a community meeting called by our mayor, Jimmy Cockroft, who really, I think, tried to get us out front on this. And at that time, I think Mississippi was reporting 10 cases. There were no cases in Attala County. We all talked about doubling times and reminisced that probably by this time we would have 100 cases. Now I think we've got, as of yesterday morning, 937 cases.
Yeah. It'll be over, most likely over 1,000 by the time we get the new one. Can you hang on for a minute? Because I'll ask you through your expertise, exactly what you would recommend as far as PPEs and the shortages of masks and all of those things. Dr. Tim Alford, ER doctor at Baptist, and we're going to continue the conversation with him in a moment or two, right after this. There you go. Dr. Tim Alford, and we were talking to him. I want to ask you this, though. When you look at what you could have done differently back when you were there, did you have the supplies, or are there supplies now for people in the medical situations that they're in this environment? Certainly in the emergency rooms. Do you feel pretty confident that we're getting the stuff that we need?
Well, the Baptist Health Center so far has kept us well supplied with protective equipment, but we're starting to run thin for sure. Yeah, that's a good question. For the life of me, we were using great precaution. Very early on. March the 1st really was the first case of this stuff in New York. And now look at New York. We were not very far behind them, and even then we were using every precaution. And yet somewhere along the way I got this virus, and a colleague of mine got it as well, and another colleague probably has it. Nurses and an X-ray technician has it in our hospital as well. And we were using precautions, so this stuff is very contagious. There's no doubt about it, and that's sort of the the reality about this is that majority of the cases, the active cases, you look back and you cannot figure where you got this from. Although we are relatively certain that we got this from an active case that progressed through our system. Most people that are going to get this virus are going to get it from somebody they had no idea had it.
When you go back and you look, and I'm talking with your talking with your colleagues, and you kind of wonder how early. You said March, but I've heard people say that they had something that they swear they think maybe because they went to the doctor, they had flu-like symptoms, and I've heard as early back as November of last year during Thanksgiving, but certainly more people in January. And some even after Christmas and during the Christmas holidays said, we went to the doctor, we had the worst case of flu, and they said it was not the flu. Do you think it may have happened a lot earlier than people think?
I think that's a distinct possibility. Of course, the first real case that came out of Wuhan was late December, and it spread. The prevailing conventional thought is that is where it came from, but it may have had a little bit of a foothold in communities around the country well before we knew about. And like I said, March 1st was New York's first case, and look where they are now. Same in the Seattle area. This stuff is moving very fast. And if you look around the country and you see how it is staging differently in different communities, it seems like it's more lethal in certain communities almost than in others. I think our state we're in a position where we can see what's happening in other communities and maybe try to get ahead of the curve. It's my hope, really, that there will be more of a high command national approach to this. We've heard about the Defense Wartime Act being invoked. I think it's really time that we get a very clear a national plan, because right now it's shop on eBay for your PPE, and states are having to do that and fight for it versus being able to have an organized, almost military-grade deployment of equipment around the country.
Yeah.
Because if we're saying that this is almost like a war, like World War II, we really need that kind of lift at this time, and it needs to be a clarion clear message coming from the top. If you wait until this stuff gets on you, you've waited too late.
Louisiana, as of yesterday in Louisiana, we have 937, I think you said, as far as total cases. In Louisiana, right across the state line, this morning, and this will be updated, they have not 937, they have 5,237 diagnosed cases in Louisiana. They have 239 deaths in Louisiana that are known coronavirus-related deaths, 239. We have 20. Hospitalized patients from this, 1,355. They have 438 patients on ventilators, and the parishes with diagnosed cases are 60 out of 64. We have 76 out of 82 in our state. There are only 6 counties in Mississippi that haven't reported any cases, and that could change with the morning report this morning. Final question here, Dr. Tim Alford. And I know you're following this with Dr. Birx and Dr. Fauci, do you take issue with anything, or do you think they're on the right track here, and you look at the models and you hear what they're saying? From the expertise that you have, do you take issue, or is what they're saying make sense to you?
It absolutely makes sense. And as honest and forthright and dead on as Fauci is, I think there are other people around the country that think that we may have more than 250,000 deaths before this is over.
Mm-hmm.
Because if you look at the percentage, the mortality right now in the U.S. is right around 1 to 1.5%. If 40 to 50% of people in the United States get this virus, you figure, 150 million people, 100 to 150 million people that get the virus, what's 1% of 100 million? And so I think that 100,000 to 250,000 deaths, which is what Fauci is saying, is very real, and that is why, in my opinion, I think we need a national plan.
I do want to ask you this: when you start looking at,
than anything since World War II.
Yeah, I want to ask you this: when you look on the positive side, as fast as we're doing this, dropping some regulations where we can drop them, using some of the drugs that are available on the market now for malaria and et cetera, do you see us being able to tackle this? And how long do you think we'll be there with a vaccine, with some medicine for those who are already have it, and for the reoccurrence, which, according to Dr. Fauci, will happen again probably this fall? What are your optimistic, or do you have an optimistic grasp on this, that it may look a lot different next year at this time?
Well, Fauci also says that he feels like we will be better prepared for the second wave. He's pretty certain we will have a second wave in the fall. If this goes anything like the great influenza of 1918, the second wave was more lethal than the first. But Fauci thinks we will be better prepared for the second wave. And I don't know right now, from what I understand, still 12 months to 18 months to develop a vaccine. You hope that the vaccine works. They have trials now for vaccines in the Washington area, and you hope those vaccines work. And I do know that therapeutics have the whole trials for therapeutics around the country. Computer modeling is now accelerated. There's the ingenuity of America is where our hope is.
Yeah.
In the meantime, the public, all of us, this virus knows no party line. It does not care about a county line. What it cares about, it's doing its dirty work, and we've got to come together as a community and stand apart. I mean, that sounds like a paradox, but we really, the carnival atmosphere that's going on around the state, people still ride. I tell you, there's a theme in all this, in all of these pandemics. One of them is boats. Boats seems to be a common part of all of this. Big ones and little ones.
You mean floats and boats and things such as that? Okay, look,
right.
we're out of time, but I'd love to get back with you a little bit later on and check with you and get your thoughts. Maybe soon we'll be able to get you in the studio and we'll talk about this at length when all of this is over. Dr. Tim Alford. We got more